Good morning. So these are my eyes when I wake up in the morning. Look, ptosis barely appreciable. We have the marginal light reflex and the lower lash line. If I raise my eyes, there's actually like some lift. Like, see? Yeah, it lifts over. Yeah, that's my eyes in the morning, and these will very soon not be like this, so thought I'd catch it for you. Hi. Hello there. Hello. Oh, yeah. I have a couple of chronic illnesses that involve chronic pain, chronic fatigue, also muscle weakness. And so that makes doing things like showering extremely difficult. A few years ago, I started noticing that rather than showering every other day, I was showering like every 3 or 4 days because I wasn't physically able. And over time, that went from every 3 to 4 days to every 5 to 6 days to every 7 days. And I'd really be pushing myself. A month ago, something like that, before I had a personal care aide, that was 10 days I went without showering. My stretch goal has been shower 3 times a week and shampoo and blow dry the hair twice a week. Now I have a really long hair, so it takes longer to bathe than most people, but this is the day I want to share this success with all of you. So my personal care aide just left, and she was like, "You reached your goal." Huge, huge success. I have showered 3 times. I've gotten 2 shampoos in. Stretch goal achieved. Awesome. I'm ready for a nap. No vlog would be complete without Jeffrey making a cameo appearance and, of course, hogging my spot on the bed. Yeah. So my personal care aide commented that he's kind of like a service cat, except he doesn't really alert or task. Although I have noticed on days when I'm in a lot of pain, he will actually like crawl up on top of me. Now, he'll also crawl up on top of me, but he's usually like goes whap whap with his paw. When, if for example, I fall asleep and don't ensure that he has enough food to get him through the night into the morning, he will wake me up, and I do wake up for that, but I'm usually pretty good. Hi, mister. He only has had to do that a couple of times, so that's good. I'm usually really right on top of that. Sometimes he will also climb on top of me and go whap, whap, whap if he's had a tremendous stinky in the litter box and wants me to take care of it right away. He's very clean and fastidious. I tend to be similar, except you'd never know it for the clutter in the background, but that's what chronic illness does. It causes us to not be able to live the lives that we prefer to live. It sometimes requires us to make adjustments and changes that we wouldn't want to make if we had a choice. So that's a little bit of an awareness tip for you. It's like I'm in my pajamas now. This is not my preferred way to be in the world. I have some pretty interesting clothes, but I tend to go to thrift stores a lot, and so like this was a really nice a nice piece where there's some interesting oops, I'm just going to take this right off the hanger, I guess. This is like kind of like an open long blouse, and it's got some stitching on it. Here's like a knit piece, and you can see it's got a little bit of beading, and that's like a little frilly sweater for like summer and air conditioning, to like throw it on when you go into an air conditioned space. And this was really inexpensive at a consignment shop. Really, like, I love stuff like this. This had the tags on it, the original tags, ridiculously inexpensive at a consignment shop. I do worry sometimes about the labor that went into this. If the I worry about things with clothing like child labor, which is why I tend to get everything at thrift stores. Profit is built on two principles: exploitation, whether you're exploiting resources or you're exploiting workers or you're exploiting consumers. There is an element of exploitation. And then extraction. And extraction can be extracting resources, particularly when we're talking things like drilling, mining, things like that. That's really true extraction. But also the extraction of wealth flow from the general population, and you're extracting from the whole of society and you're concentrating it into, the elite. I want to try to reduce my participation in that kind of way of being in the world. Test results. At the end of last week, I went to my neurologist awaiting 2 test results. CT chest scan without contrast ruled out thymoma or mediastinal mass. They also tested for muscle-specific kinase antibodies. It's a type of myasthenia gravis that's harder to treat, requires prednisone, which my body doesn't tolerate because I tend to get really anxious, agitated, and mean. There's no increased risk for myasthenic crisis because I don't have the MuSK myasthenia gravis. So I have the same level of risk for a myasthenic crisis as everyone else who is diagnosed with myasthenia gravis. So there is a risk. It's just not increased. Where does that leave me? So in my previous neurological appointment, I was prescribed pyridostigmine bromide, which is the generic for Mestinon. Most people do really well initially with an acetylcholinesterase. So for me, it was like taking a sugar pill. So I'm double seronegative, and the pyridostigmine bromide isn't working at all. So where does that leave me? All right, well, the neurologist did enter myasthenia gravis as an active clinical condition into the patient portal. He's made the diagnosis clinically based on presenting symptoms. There's some confounding things going on. So there's some other things that are happening with my body that appear to be neurological in nature that myasthenia gravis does not explain. The myoclonic twitching, no explanation for that. We don't know what's causing that. We're not even really sure what's going on. Other muscle twitching in my body, that happened before I started taking pyridostigmine bromide, so it was not a medication side effect. It continued while I was taking it. And, that's kind of fluctuating, just like all the other stuff. Could that be caused by fibromyalgia? We don't know. So there's some confounding things. I'm not a simple case of dealing with just one diagnosis. And because I'm not fitting into any neat sort of boxes, he wants a second pair of eyes on me within his practice. 4 months from now, I'm going to see his physician's assistant. She's got some alphabet soup after her name that allows her to do just about everything that an MD or a DO is able to do. So she's going to do a full hour-long assessment, which I never got with a neurologist. So the good thing about having somebody that may be newer to the field and not have a lot of experience is that, I think about when I went to school for science, there's been a lot of advancements since I went to school. So somebody going to school now is going to be more knowledgeable and informed about current things than I was then. So I'm hoping there's a similarity. Like, she may be aware of more advances in neurology because I'm double seronegative without corroborating evidence. I've got other neurological things going on that we don't know what it is. There's no treatment. So normally the next step for somebody that is totally refractory to the pyridostigmine bromide, that's just totally non-responsive, the next step would be try a course of prednisone. you know, at this point, I don't know what the next steps are, because I'm now waiting for months with no medication for fibromyalgia, no medication for myasthenia gravis. The best I can do is ibuprofen and vitamin D. This sucks. It's been a very long road and a long journey. I'm pretty worn out. I'm pretty frustrated. And okay, so I know the last segment of video is a little bit choppy. I did want to clarify the benefits of trying prednisone based on my body's normal reaction to it, or the benefits of trying immunosuppressants, which are highly toxic with a lot of side effects, do not outweigh the risks of trying to take those. So that's why there's no treatment. If my symptoms get a lot worse, we may at some point readdress, risk versus benefit. I did get to spend time with my friends this past weekend. Well, I was kind of surprised I didn't crash in the middle of the weekend, but I did crash hard on Sunday. So they brought me home Saturday around dinner time, and I went to bed, and then Sunday mid-afternoon I crashed. I'm kind of at the end of my steam right now. If you have been asking questions, commenting, or otherwise engaging around the videos that I post, thank you so much. It means a lot to me. Obviously, having a chronic illness, or multiple chronic illness in my case, is absolutely no fun. This is a monologue, but your participation makes it a dialogue, a conversation. Thanks so much. I don't have a regular upload schedule, so if you want to know when my next video is, please subscribe to my channel on YouTube. And also you'll notice that there's this bell symbol. Yes, click on that and you will get the notification that, ding, I have uploaded a new video. So I'm going to sign off now, but after I sign off, I'm going to add like a little treat of some videos that I took over this weekend. They're very short clips of some stuff that brought me joy. So with that, I'm going to say keep on watching after I sign off, but I'll do that now. Thanks so much. Catch you next time.